Hi, my name is Joanna Ramey. Thank you for having me here today. I am one of two speakers that you'll have today. Today's meeting is about health, women's health for the mind, the body, and the spirit. My section will be on the body, and I just wanted to cover some general things that every woman should know. A big thing in healthcare now is prevention, so catching things before they happen. So one of the most important things that we need to remember are routine checkups. That's my first thing. These are this is a little list of things that we should do every year. And the first thing I put was a checkup. Everybody should make sure, every woman needs to be pretty consistent on going to the doctor every year to have a checkup. At that checkup, make sure that your doctor checks your height and your weight and checks your BMI to make sure you're at the right where you should be. And that, it's also a good time to get your blood pressure checked, to get some routine lab work done. This one is to check your blood sugar. This one's to check your thyroid counts. And then this one, if some women tend to be anemic, so they could get lab work for that. Also, you want to write down some issues before you go that you think you might be having some concerns. If you have any questions about medications that you're taking or anything, just jot a few ideas down before you go to the meeting to make sure that all your ideas are there on paper so you don't get caught up in what's going on and forget to ask him something. The next thing is a clinical breast exam. Monthly, we should all be doing self-breast exams on ourselves, but once a year we should go either to the OBGYN or during our routine checkup with our regular family physician and have them just do a clinical breast exam to make sure they don't see anything. And that should start after age 20. A pelvic exam also should be done just to make sure there aren't anything abnormal going on down there, and that should start also after age 20. After age 40, we need to make sure that we have a pap smear every year and a mammogram, and a lot of women find that it's easy to schedule these yearly things like around their birthday or around their anniversary. That way it's easier to remember. You should also do a mole exam. Just if you have any concerns, this could also be up here with your routine checkup. If you see a mole or anything that's abnormal, just make sure you have your doctor check it out. You should get an eye exam every year and at least a dental exam. If you're high risk, so if you drink dark colas or coffee or anything like that, they want you to get a cleaning every 6 months. So you could talk with your dentist about that. After age 50, you need to make sure that you are scheduled for a colonoscopy. And depending on your risk, you might get it every year or every, 5 years. If you've had a polyp, I know sometimes people have to come back every 3 years. And for women, after the age of 50, we should at least once get a bone density exam. Just at least once, and then from the results there you can tell what you would get if you need it every year from there, or if you never even need it again. But osteoporosis is pretty important and is common in women. And with all these, you just need to, they'll all vary depending on your genetics and what findings have been found in the past, so just talk with your doctor. Some immunizations to remember. These are pretty important for preventing common, illnesses. A lot of people each year die from the flu. These are just things that you just want to make sure you do have in check. A seasonal flu shot. They have these clinics at Kroger. They have them, at different stations. You can get your yearly flu shot. These are really important to get. The pneumonia vaccination, they're recommending it for age 65 and over. Anyone that's high risk, so a decreased immune system, and they're saying you need it about every 3 years. Tetanus shot every 10 years. You never know when something's going to happen around home. So you just want to keep up on that. The HPV is a vaccination for women that are under 26 years old, and this has been found to help prevent cervical cancer. So for some girls, they might be thinking about this. And the meningitis vaccination, that is really important for people who are in the military or live in close proximity to others, like in a dormitory. It's really important because, you know, it's one shot and a couple boosters after that, and that can protect you from a very fatal disease. So, and then also for people over 60, if you know that if you've had problems with shingles or anything in the past, they now have a vaccine for herpes zoster to prevent any more outbreaks. Another thing I wanted to talk about, because women are generally better at taking the vitamins, I didn't know if everybody knew what each vitamin was for. Vitamin A is to help vision in your skin. B is to increase your metabolism. Vitamin C helps you in your immune system. Vitamin D helps your bones, your immune system, and your brain. Vitamin E helps your muscles and your brain. For women over 40, there are about 5 that they say you should take daily. Vitamin D is one that you should take daily. Calcium and magnesium you should take daily. A multivitamin tablet, which they have now found that it's actually more helpful if you take half in the morning and half at night. So it gives you like a really good consistent dose of that. You should also take an omega-3. That's really good for decreasing chances of heart disease and plaques. And then a baby aspirin that also helps with heart disease to prevent that. There's a lot of talk lately about what vitamin D does, so I wanted to cover this a little bit. I know that a lot of people are reading articles that say vitamin D can help slow the progression of Alzheimer's or dementia, and you know that it does help in neuromuscular function. It does help in your brain function, and it also helps with absorption of calcium in bone health. It helps boost your immune function. It helps decrease inflammation, and it protects against some form of cancer. So, you know, you could talk with your doctor about taking some vitamin D. The last thing I have is activity. We all know we should be drinking 8 glasses of water, so I didn't want to, you know, push that anymore. That's kind of a known fact. But a lot of people don't know exactly how much activity we do need. Adults need at least 150 minutes or 2 hours and 30 minutes of moderate intensity exercise a week. This could be a 10-minute brisk walk 3 times a day for 5 days a week. And 10 minutes is nothing. It takes us 10 minutes to take the trash out. It takes us 10 minutes to do, you know, to run into the grocery store, and, you know, but I just wanted to give everybody an idea of what the type of exercises were. A light intensity would be like shopping, cooking, doing laundry, running around the house. A moderate type of exercise would be walking fast, water aerobics, which is really good for elderly, riding a bike on level ground, playing tennis, pushing a lawnmower. And, you know, these are things that will actually increase your heart rate enough to count against these 150 minutes. Vigorous exercise is like jogging, running, lap swimming, biking on hills, basketball. These are things that are high intensity and that would help you lose some weight. So if any of you guys have any questions about these, I do have some handouts that are going around that talks about a pap smear, the BMI chart, and a self breast exam. So if you guys want to look at those, and if you have any questions, let me know. Thanks.